Hey, this is a tutorial on open disclosure, and as you see, I'm recording this. It's the 4th of February in 2021. So let's have a look. So firstly, what is it? What is open disclosure? So if you read here with me, open disclosure describes the way clinicians communicate with patients who have experienced harm during healthcare. So why do we have it? What is it? Open disclosure is intended to assist patients that have experienced harm, guide clinicians, the clinical workforce, and health service organization in supporting patients that have experienced harm, ensure that health service organization learn from adverse events. Okay, so that sounds pretty generic, so let's a little bit deeper into it. So what are the main elements then of open disclosure? Well, an apology is made or an expression of regret. So whoever is doing this, whatever they prefer, an apology or an expression of regret. It should include the words like I'm sorry or we are sorry. A factual explanation of what happened. So that's really important. Just the facts, nothing more. An opportunity for the patient to relate their experience of the adverse event. So they feel acknowledged. A discussion of the potential consequences of the adverse event, and an explanation of the steps being taken to manage the adverse event and prevent recurrence. So this is what I found in the documents of the National Health Standards, and also there's a Australian document, but they say, why is it important? So when healthcare does not go to plan, evidence suggests that patients want to know and understand what happened and why. They want to feel there is genuine regret that the event occurred, and they want to know that steps will be taken to minimize the risk of similar events occurring again. So again, you can see it's very generic, very much like a national standard, very logical. Um, For clinicians, there's often uncertainty and confusion about disclosing information when healthcare does not go to plan. However, actively and openly managing such incidents, including through the exchange of timely and appropriate information, is important for the recovery process of patients, clinicians to manage their involvement in and recovery from adverse events, health service organization to learn from errors. So, if you're still with me, yeah, this all seems to make sense, but there are some big questions to ask, of course, when I do this stuff on the line. But anyway, another page on importance first. So, in working towards an environment that is as free as possible from adverse events, there is a need to move away from blaming individuals. And so this is very important. But are you certain that that will not happen? So there is a need to move away from blaming individuals to focusing on establishing systems of organizational responsibility. And this kind of trust in the organization that you as an individual will not be blamed, and you will also not be blamed by the patient to whom harm has occurred. But it is important for this open disclosure, of course, to work that this is the case. So in this context, open disclosure can improve patient safety and quality of care through organizational learning, increase trust between patients and their clinicians, and assist patients and their families and carers recover from healthcare harm. Support staff through understanding and managing unintended patient harm. All right, let's move to the page. So when is it needed? Open disclosure is required when a patient has suffered unintended harm during healthcare. This may be a recognized complication or an unanticipated incident or a result of human or system error. If it is agreed by the clinical team that due to exceptional circumstances, an incident will not be disclosed, this should be noted in the patient record along with reasons for it. And so there's a reference made to the Australian Open Disclosure Framework in section 2 and 7. But this presentation really doesn't lead to perusing that entire document. But in case you want to look it up, that's where you. So, big question, what about liability? So, open disclosure encourages clinicians to acknowledge that an adverse event has happened and to apologize or express regret for what has occurred. So, we've seen that before. So, this is important. Open disclosure does not of itself create legal liability. And I'm not a legal expert. And of course, you must be really trusting in these statements that are being made. The people who write these documents, of course, promote it, but yeah, I cannot judge how true that is. But open disclosure does not of itself create legal liability, such as the statement in the national standards. Acknowledging an adverse event, apologizing, or expressing regret is not an admission of liability. Liability is established by a court and is based on an evidentiary matrix which may, in part, be based on statements made either before or after the event. So, yes, this is what the national documents and explanation put forward. I'm not a legal expert, so I can't comment, but this is what's been stated. So I just snipped an aspect from the Australian Open Disclosure Framework about liability, and this is what it says. Some legal aspects of open disclosure. So all states have now enacted legislation that limits the extent to which an expression of regret may be used to ground an inference of liability. Although it is sometimes possible to infer that a person is at fault from the nature of their apology or expression of regret, an expression of regret or sorrow is not the same as an admission of liability. It is prudent to record in the notes the actual words of the expression of regret and to consider expression such regret in the presence of a witness. In any discussion with the patient and their support person during the open disclosure process, the healthcare professional should take care not to state or agree that they are liable for the harm caused to the patient. State or agree that another healthcare professional is liable for the harm caused to the patient. Or thirdly, state or agree that the healthcare organization is liable for the harm caused to the patient. So it takes practice in how to have a discussion with a patient when you act in open disclosure. And I'll give you some references to some MATA training that's available on LIB, and I highly recommend it because it's done excellent and gives you a good idea where there's traps and pitfalls and what you should be avoiding and how to go about this. So, legal advice suggests that an apology is not an admission of liability. So once more, and that there are no legal impediments to an appropriately worded apology. It is not an admission of liability to say the words I am or we are sorry. Explain how an adverse outcome occurred. Acknowledge that the patient is not happy with the outcome. Express your concern for the patient. All right, so those 4 things are not equal to admitting liability. So they're given a few examples here. I'm very sorry this has happened. I am sorry that this hasn't turned out as expected. If you want more information on it, then I refer you to the Australian Open Disclosure Framework, and it's section 1.5 and part B. And there's a support resource, Saying Sorry, a guide to apologizing and expressing regret in open disclosure. So there's the website, www.safetyandquality.gov.au/open disclosure. So, third section about liability, because of course this is a hot issue on anyone's mind. So, whether apologizing or expressing regret, speculative statements must be avoided. So, keep to the facts and the facts only, as should apportioning of blame to oneself, other individuals or institutions. So, there are a few more legal considerations, and I don't want to go into it to not make this war and peace, but freedom of information is one of them. Privacy, defamation, and also qualified privilege. Is it mandatory? Okay. So can I just not do it? Well, open disclosure is an accrediting activity under the National Safety and Quality Health Service standards. Criterion 1.16 of Standard 1 requires the implementation of an open disclosure process. So this means that health service organizations accredited to the NSQHS standards, including public and private hospitals, day surgery units and dental clinics, must implement open disclosure in accordance with the Australian Open Disclosure Framework. More information on the evaluation requirements and criteria for open disclosure under the NSQHS Standards Accreditation Scheme is available at, here's the web link, www.safetyandquality.gov.au/our-work/accreditation. So, a little bit on the Australian Open Disclosure Framework. It should reflect the latest evidence and practice of open disclosure. Provides a framework for clear and consistent communication by health service organizations, staff with patients when healthcare does not go to plan. And it also includes guidance on discussing what has happened, why the incident occurred, and what's being done to minimize the risk of it happening again. So this is another snippet. So the Open Australian Disclosure Framework endorsement was formally endorsed by Australian health ministers, and it's also been officially endorsed by the following professional organisation: the Australian College of Nursing, Australian New Zealand College of Anaesthetists, Royal Australian New Zealand College of Obstetricians and Gynecologists, the Royal Australian College of Physicians, the Royal Australian College of Surgeons, Society of Hospital Pharmacists of Australia, and it is supported by the Australian College of Emergency Medicine, Royal College of Pathologists of Australia. And finally, the Royal Australian College of General Practitioners has officially recognised a supporting document implementing the Australian Open Disclosure Framework in Small Practices as an accepted clinical resource. So finally, I think we have two more slides. So this one is about the MATA governance. So on LEAP, we have two courses you can do. One is called Open Disclosure Conversations, and the other one is called Open Disclosure Principles. We also have a procedure, PR CSS 000017, called Open Disclosure Procedure. And finally, thank you. I hope it was informative. Any questions? Please email at michael.visser@mata.org.au. Thanks. Bye.